So we're talking about the detox programs. Now Panchakarma is what we call a bio-purification program. It's not a therapy, it's a program. In India, it takes anything for people with chronic issues like Alzheimer's or Parkinson's, and somebody recovering from cancer who've just gone through chemotherapy. It takes 3 months. It's a 3-month program. And they actually admit you in the hospital, Ayurvedic hospital, and they control everything that goes inside your body. They control what comes out of your body. So there is no way we can teach you Panchakarma in 2 days. The program that I attended was a 6-month program, and even now, I don't think I'm a great Panchakarma therapist because it is so comprehensive. And Ayurvedic doctors have to attend a 2-year program to become Panchakarma specialists. So this is just an introduction to what Panchakarma is, that is all. So in the United States, you will find, you go, in fact, even in Europe, they will say, oh, we offer Panchakarma therapies. What does that mean if Panchakarma programs are 3 months? Because Panchakarma program is 80% about the diet, 20% about massage and cleansing therapies and body work. Just 20% is about the therapies, 80% is the diet and the herb protocols. So some of the therapies, for example, Abhyanga, does anybody know what Abhyanga is?
I've heard of it.
Abhyanga is an Ayurvedic massage. So we offer it, people walk in, you want an Ayurvedic Abhyanga massage, we give it, it's good, it's nice, just like any other body work, but it is actually a part of Panchakarma therapies. So for somebody who's Vata, who's recovering from, let's say, colon cancer or some Vata imbalance issues, they have heart problems, then we do Abhyanga 6 days to 21 days every single day. So Abhyanga is Ayurvedic massage which is done, and the oil that we put on them, we actually cook it, and the same oil that we're putting on their body, they eat it in their food. Ideally, so we are taking the herbs, they're internally taking it with their food, and then they're externally it's being put on their body. Because in Ayurveda, skin is the largest organ. So Panchakarma therapies, Abhyanga. Then Shirodhara, does anybody know what Shirodhara is?
That's the drippy oil on the head.
Yeah, drippy oil. Okay. Never heard it being described that way. But it can also be used in Europe. It's so popular as a spa treatment, and everybody's doing it. And I hate Europeans for what they've done to Ayurveda, because they go to Kerala, they go to India, they pay obscene amount of money. And if I go and I cannot afford to get a Shirodhara in India, it's way too expensive. You go to a 5-star hotel and it's, but here my rates.
So when I first started doing Ayurvedic medicine, was at Deepak Center, who was in La Jolla, and he had the Triple Center for Center for Well-Being. So that was before the Costa. And I was hired as a therapist fresh out of IPSB. This was in 2000. And knew nothing about Ayurvedic medicine. I didn't even know who Deepak Chopra was. I just needed a job. That's all I knew. I had no idea what I was getting myself into. Just one of the people that worked in the office took a liking to me and said, "This is the job that you need to have." And so I said, "Okay." So I went over there, and I spoke to the director, and she liked me, and then I went in for a sample massage. And I don't know how many of you are from IPSB that are therapists, but obviously I'm from that school, so I think, it's the best teaching that out there for massage, and it still is to my mind. So they were looking for people from IPSB, very specifically. So I got the job, and they knew I knew nothing about Ayurveda. So it took about 10 weeks of intensive training, 8 hours a day, with only weekends off. And we all performed the procedures as well as experienced them ourselves. It was really, really difficult, and many of us processed, and none of us were really properly prepared for it. So that's why it's really good to know the preparation phase of Panchakarma before you actually do it, because it can be very damaging. It can actually not be good for you. So one of the main massages, I guess you want to call it massages, but that's what we did, call it, was an Abhyanga. And you had to learn that firsthand because it took the longest. It took us nearly 3 weeks, 8 hours a day to learn the Abhyanga. Most of the Abhyanga was two-person. So you could do an Abhyanga by yourself, but it's better to do it two if you can. So you have one person on the left side of the patient and one person on the right side of the patient. In this type of treatment, I explained to, and Monica knows this too, it's the way she does Abhyanga is a lot different than the way I do Abhyanga and the way I was taught at Chopra. But it doesn't mean that it's any less beneficial. It's just that it's a technique, I think, that's more spa-related. I've had Abhyanga from Monica before. It's a lot different. For one thing, you're completely nude in traditional Abhyanga, which is what I wanted. In Abhyanga at a spa, of course you can't do that, so you are covered. So the main purpose of Abhyanga is, what I was taught, was friction and to get the body heated. And as we all know, our toxins are very sticky, like she was explaining, like in the trash can. So you have to heat that toxin up because I almost look at it as like a gooey black, in my mind, that's how I see it. And when I work on my clients, I always use a lot of heat, and still to this day, and that's all from learning that from Ayurveda. Heating the oil, keeping the room at least 74 degrees, it was all about heat. But with an Abhyanga, it was all about oil too. So we had these oils that were cooked and cured there at the kitchen. So we would have a little cup of oil, and we would put it on a hot plate and keep it hot that way. Then when the time came for the person to have the Abhyanga, they would sit at the edge of the massage table, just a regular massage table with a sheet over them. They would sit, and then the therapist, especially for me, would have to have a step stool and stand on either side. Therapist 1 had what they needed to do, and therapist 2 had what they needed to do in the beginning, but in the middle of it, well, I'd say probably in the first 10 minutes, then we were simultaneous. We did everything exactly the same. Every movement was choreographed. Everything was memorized. So that's why it took a good 3 weeks, and even at that, we weren't, unless you start doing it, you're not very good at it. Abhyanga had counts, and I don't know if traditional Abhyanga does, but we counted every stroke. So long strokes, long limb strokes were counted usually in a series of 5. And again, you're trying to get that friction going, trying to get the heat, the body to start heating up so we could move the ama. Around the joints was always circled because you do want to bring some warmth to the joints, but we as massage therapists know that we don't really use a lot of tension on the joints, so we just want to bring some heat to that area. So they were usually only circled a couple of times, moved on again a lot of friction. So I'm using this movement because in my mind, my body reacts to that thought of doing it. So it sounds really kind of a little gruff, but it was a dance. I mean, we came into the room, and from that moment on, we honored that opportunity to treat a person with this style of massage. So I think intent is really important when you do an Abhyanga. I think that it's so different than doing a regular massage in a spa or wherever you work, in that as a therapist, you feel this sense of responsibility and honor. This is an age-old technique, thousands of years old, and you just feel this overwhelming urge to just give every ounce of yourself to this massage. I do have to say with the Abhyanga, unlike massage, I don't pick up a lot of that energy from a person, and I'm not quite sure why that is. But maybe it's because that intent is different. But I did bring my manual from Chopra Center, which I've carried around with me for the past, it's almost, now 10 years. And it's a prized possession, it really is. It's something that I'm not quite sure if I should have had, or we were supposed to take. So I do have the Abhyanga all written down, with my little notes on there and everything. So I would love to show, Monica wants to see it, and I would love to show you also how we did it at Chopra Center. But again, it's an opportunity to participate in something that is very sacred. And that's, I think, probably one of the most important things that I learned, especially doing Panchakarma, but the Abhyanga as well, that it was a very sacred thing. And in so much that the patients were not allowed to speak. We were not allowed to speak except for giving instruction. Everything was done in such a way that we were honoring the body and this person. Many times I always tell my friends in massage, I don't recognize anybody's faces. I know their backs. I know you if you take your shirt off. But when I worked at the Chaprasana, I knew their face. I always knew their face. So that's just a couple of things about it. I know that there's probably a lot of questions. It's really hard for me to explain or really tell you what an Abhyanga consists of without seeing it done. And I'll do the best I can. It's been a long time. I do a little bit at the spa I used to work at. We were trying to get Ayurvedic into that spa. It never really came to fruition, which is sad. But I'll show you a little bit of the strokes today, I hope. But if you have any questions, certainly I'll be happy to try to answer some of them. I'm sure Monica knows much more than I do. I will let you know that working at Chopra Center, we did not diagnose. We had a separate doctor that did that. So when they came to us, we had a prescription. And so we did what that prescription said. But I'll tell you that the people that came to see us treated us like we were angels. Many times they come to the back door and worship us, and it was the oddest feeling. But that's how it was treated there. It was as people that came to us, like I was explaining to you, knew what to expect. They knew they were going to have to give something of themselves. So they really appreciated all the hard work that we did and the love that we had for them and the practice for Ayurveda. So, do you have any questions?
So with the when you're doing the Abhyanga, how long of a session is it typically? What would normally be the time frame that you're doing this?
Well, again, we were in a spa. I was in a spa atmosphere. Mm-hmm. I know with Monica, gosh, how long was my treatment? Almost hour.
Pitta 45 minutes, Kapha 90 minutes, and Vata 1 hour.
So you mix it with the doshas?
Yeah. Well, the thing is, I'm also a massage therapist, so it's very easy for me. If somebody comes to me, I do their dosha analysis, so on and so forth, and I'm like, I cannot stand people telling me I want a deep massage. Because I'm a doctor, I'm not going to listen to you give me a deep. I tell them, this is how it's going to be. But if you have a specific area there you have pain, we will not perform Abhyanga there. We will do some therapeutic moves, or we'll do some marma on you, which is a sports Ayurvedic version of trigger point therapy. But we will do it before we put oil in you, because once the oil is put, you can't go deep. It's yes.
What happens if you have people that do not receive massage well, are very ticklish, like?
That's a condition.
That's me.
Yeah.